I'm Kevin Scanlan, and it's my honor to serve as the President and CEO of the Metropolitan Chicago Healthcare Council. And we're celebrating our 75th anniversary. We were chartered on November 26, 1935, with 23 member hospitals. Today, we have over 150 member hospitals and healthcare organizations. Our member hospitals rely on the Council to provide guidance for pressing healthcare issues of the day. Today, we remain the trusted voice and a trusted resource in the healthcare community, serving our membership and in turn, helping them provide state-of-the-art healthcare to the communities they serve. Over the past 75 years, the Council has played a critical role in ensuring that our hospitals are prepared to respond to emergencies and disasters. And after a devastating fire in 1958 at Our Lady of the Angels Catholic Grade School, the Council reviewed the emergency response procedures for all hospitals in Cook County, as well as local police and fire departments. Since the early 1970s, the Council has performed hundreds of emergency preparedness drills, training thousands of hospital employees to be able to respond to any emergency or disaster. In fact, I've died 3 times while role-playing during these exercises. Just like all other employers, our hospitals want to provide comprehensive, cost-effective health insurance coverage for their employees and their covered dependents. Today, as one of the largest health and dental plans nationwide, MCHC's Employee Benefit Plan represents 70 member hospitals and covers more than 150,000 individuals. As such, we help our member hospitals save over $2 million a year in administrative costs. The world has changed a lot over the past 75 years, and so has the Council. In 1985, we changed our name to the Metropolitan Chicago Healthcare Council to better reflect changes taking place in our membership. No longer were people receiving healthcare services by means of inpatient hospitalization alone. Surgical centers and outpatient clinics were changing the landscape of the healthcare delivery system across the nation. And as our healthcare landscape continues to evolve, one issue has remained a constant threat to the future of healthcare delivery in this region: our workforce shortage, in particular, nurses and allied health professionals. At MCHC, we've implemented a variety of programs to address these shortages, including co-sponsoring a Health Careers Charter High School as part of the Chicago Public Schools Renaissance 2010 program. We've also begun a program with St. Xavier University to increase the number of nurse educators who are desperately needed to train the next generation of nurses and allied health workers. And we create tools to assist our hospitals to move more students through clinical rotations with more coordination and ease. As we look back on the last 75 years of MCHC, we find striking similarities between the era in which the Council was chartered and our environment today. Hospitals continue to be the top employer in the region, employing over 400,000 people, both directly and indirectly, and contributing $50 billion to the local economy. This past year has brought healthcare reform to fruition, and with it a 1,000-page piece of legislation that will take years to implement. MCHC worked alongside the American Hospital Association and legislative leaders to make sure that the needs of the local healthcare providers were being heard and their concerns registered as this historic legislation became a reality. One important element of healthcare reform is centered on using technology to improve how we deliver healthcare in this country. We've been talking about electronic medical records for years. Everyone who works in healthcare can imagine the advantage of establishing a healthcare information exchange so they will not be forced to order duplicate tests for patients, as well as being able to make an accurate diagnosis when they have a patient's full medical history at their fingertips. MCHC is the leading force building a health information exchange between hospitals and other healthcare providers in the metro region of Chicago, and hopefully the state and nationally, with the ultimate goal of patient information following the patient. The delivery of healthcare here in the metropolitan Chicago area has certainly changed during the past 75 years and will continue to change as we move forward. We will continue to support our members through this period of change, fulfilling our mission to help our members care for their communities and meet the challenges of this evolving healthcare delivery system. And we look forward to the future and further serving the needs of our members here in the metropolitan Chicago area. On behalf of all the employees of MCHC, our board of directors, and our member institutions, thank you.